Good afternoon. A research proposal interpretable signal processing for seizure prediction among epileptic patients. To begin with, we talk about epilepsy as one of the most common neurological disorders affecting over 70 million patients worldwide, and 30% of those patients are actually suffering from DRE or drug-resistant epilepsy. In this study, we aim to implement an AI seizure prediction system, employing multi-strategy learning and giving explainability to AI models. Problem statement is hinged around 3 computational problems. 1, the high inter and intra-patient variability of EEG signals that complicates the generalization of AI models. The second one being the signal noise or the interference that makes EEG data noisy and hinders AI models from learning important patterns in signals and complicates seizure prediction. The last one, AI models, particularly deep learning approaches, lack transparency, and that makes it difficult for clinicians to trust their outputs. Our objectives in this study, we aim to develop an interpretable and accurate AI system for seizure prediction. Here we shall basically aim to perform feature engineering for establishing EEG feature interaction patterns for seizure prediction, to create and evaluate AI models for seizure prediction among epileptic patients, to transparently derive clinical explainers for seizure predictors, and lastly, to create an intelligent clinical support tool for predictive decision-making for seizure epileptic physicians. Significance of this study: DRE represents a high health, social, and economic burden to millions of individuals worldwide, and DRE patients suffer from recurrent and predictable seizures that increase the risk of injuries, premature death, and social dysfunction, considerably reducing the quality of their lives. In this context, seizure prediction is a game-changing solution that allows proactive intervention to improve patient safety and well-being. In the literature review, we looked at the overview of DRE, and we realized that DRE affects majorly most people from the low or middle income countries, but still even those in the high income regions are also affected. These patients experience seizures without any warnings, which usually causes death and other accidents. We also looked at the antiepileptic drugs that have been administered to patients over years, but their efficiency have never been 100% effective. A lot of drug resistance is still experienced. This resistance sometimes is caused by chronic changes in brain activity and the high initial seizure frequency that causes psychiatric disorders such as depression and also intellectual disability. Epidemiology of drug-resistant epilepsy. Epilepsy contributes to hospital admissions 1% and 3% of all the emergency visits annually. Women face problems peculiar to their gender, such as risks to maternal health, as well as greater degrees of social stigma. No one would want to deal with a woman who is epileptic. Whereas men are more frequently diagnosed with structural causes of epilepsy, they are also strongly linked to drug resistance. DRE has a high social economic impact on affected individuals, diminishing their quality of life and showing lower rates of employment. We end up looking at multidimensional approaches that must be taken to address the increasing burden of drug-resistant epilepsy. Mechanisms underlying DRE include chronic neuroinflammation, disruption of blood-brain barrier, overproduction of glycoprotein, neuronal excitability, and oxidative stress, epigenetic and genetic factors, as well as altered synaptic connections. The need for explainability is one other issue that we have covered in literature, where we look at the challenges with AI in healthcare decision-making, importance of explainability, stakeholder understanding, and then the benefits of AI, of explainable AI, which involves facilitation of their adoption. Yes, we looked at the transparency that increases confidence in AI systems and then encouraging wider use in healthcare applications. We also looked at mass strategy learning, a strategy that involves multiple learning approaches like supervised and unsupervised, reinforcement learning, and others, where we shall not only be dealing with one strategy, but a number of them aimed at enhancing generalization, increasing robustness to variability, increasing accuracy, and improved interpretability, as well as data efficiency. We look at the methodology for this study. We shall employ induction approach of learning, where we shall do the analysis on CHB MIT SCARP EEG dataset, and then we shall we'll do the pre-processing on the that data, we'll do model training, evaluation, and we'll have explainabilities on these models that we shall have implemented. Our model evaluation will employ a number of matrices from accuracy, precision, F1 score, and AUC lock. And then we shall employ XAI techniques such as SHARP and LIME. Our deployment of this system, we shall propose wearable EEG devices that will have real-time data capturing with wireless connectivity, and then data will be processed on the cloud, or shall use portable edge computing devices. Clinical integration will be implemented with APIs connected to the existing EEG systems, and then the system shall be in a position to give alerts or SMSs to patients and the caregivers before the seizures actually occur. Our data set, already said, the CHB MIT database that includes 969 hours of EEG recordings from 23 pediatric patients with ages 10 to 22. This data was collected between 1999 to 2003 at Boston Children's Hospital, and the sampling rate of 256 has obtained using 23 channel SCARP EEG systems. An existing EDA already done shall have to look at the number of seizures expressed by each patient, and patient with ID12 experienced maximum seizures of around 40. We looked also at the distribution of seizure durations, and most seizures took between 15 to 100 seconds. And then the distribution of seizures and non-seizures according to the to the ICTO and ICTO1 or ICTO0. The research contributions: advanced signal processing and feature extraction, automated prediction of seizures, and model explainabilities are the research contributions that we expect to make at the end of this study. Thank you.